There's one other number to add to all that economic stuff we were talking about this morning, and this came out this morning too. Article by Ali Meyer in CNS News. 11.4 million Americans aged 16 and over have left the workforce since President Obama took office in January of 2009. I'm not blaming President Obama, but I'm just saying these are the numbers. According to the data released today from the Bureau of Labor Statistics, kind of a nonpartisan group. In July of 2014, there were 92,101,000 Americans 16 and over who were classified as not in the labor force, meaning they did not have a job, but they didn't actively seek one. In the last 4 weeks, the number has increased by 11,472,000 since January of 2009, when the number of Americans not in the labor force was 80,529,000. So just another number to put out there as you try to get the whole mosaic put together here in the whole picture so we can see it and discuss how to make these things better. With us this morning is Dr. David Hogberg. We always enjoy having him on. He's a healthcare policy analyst for the National Center for Public Policy Research. And there's a bombshell report out that exposes Valerie Jarrett, who's apparently dealing behind the scenes right now with the health insurance company, a Bailout Scheme. If you don't know who Valerie Jarrett is, she is the shadow to President Obama. She is his closest aide. And Dr. Hogberg joins us this morning to get into that and much more. Good morning, Dr. Hogberg. Great to have you back. And I will say David right away. Good morning.
Well, thank you, and it's good to be back.
Tell us about this report, because a lot of people, this is one that's kind of flying underneath the radar, and yet at the same time, it's one that a lot of people said would happen if the health insurance companies were not making the kind of money that they said they wanted to make. And I wanted to add to this, I just saw the other day that Aetna came out and said that they're not making that kind of money and that the prices are going to be a lot higher than they thought they were. Add to that the Hogberg decision last week that says national exchanges, a federal exchange, cannot pay out subsidies, even though that's kind of on hold right now, and only 16 states can. You're getting some real problems there. So Valerie Jarrett apparently working behind the scenes.
Well, it's the report comes from the House Committee on Oversight and Government Reform, and it's one of those rare government reports. It's actually something of a page-turner, believe it or not. There are so many things this report reveals. For starters, Obamacare is becoming an object lesson in crony capitalism from top to bottom, and of course, this administration has been plagued by crony capitalism, much of it, their own doing. So it's not really a surprise that Obamacare is looking that way as well. But basically, what you've got here is a relatively cozy relationship between players and big government, and in this case, big insurance, which has resulted in big business, making money not necessarily by pleasing customers, but by getting favors from the government. In this particular case, increasing the amount they're going to get from the risk corridors, and the folks in government, get the support of big insurance in terms of promoting Obamacare. And as was made very clear by the report, one of the insurers said that, look, if we don't get the money we need from the risk corridor, premiums are going to go up 20% for 2015. And so by giving them the money, basically the administration gets to avoid seeing massive premium increases. Those premium increases would be announced in late summer, early fall of this year. In other words, they get to avoid big premium increases coming out right before the election.
It's interesting. I was reading this. I referred to that Aetna CEO. His name is Mark Bertolini. Mm-hmm. And he came out the other day and he said the Obamacare numbers are worse than we expected. That was in the Washington Free Beacon. And what he said is the numbers were worse than we expected. We do see the demographics skewing a little older, a little sicker. Are these profitable customers? The host asked on a CNBC show, Squawk Box. He said, we don't know yet, Bertolini replied. We don't know what their margins are. We know that they are sicker. We know 87% of them are subsidized. We know that they are older, so we expect that they're going to use more health care. And so we're finding out exactly what a lot of people predicted in the beginning, that the numbers are going to be a lot higher, and there's a lot more unintended consequences happening here with Obamacare than we ever thought might happen.
Oh, yeah. Well, the report notes that I think the the insurers expected the over 55 group to be maybe about 16% of the total enrollees, but they're in fact now 25% of the total enrollees. And the report also notes that they didn't get quite the number of children enrolled in these in the exchanges that they thought, which the authors of the report suggest that that's probably an indication that families are not, in general, not finding good deals, in their price range on the exchanges. So, a lot of the predictions that have been made by Obama critics are, at least as far as this report goes, are being confirmed.
We're talking with Dr. David Hogberg this morning, a healthcare policy analyst at the National Center for Public Policy Research. One of the things in the report that I read, as written, Obamacare provides numerous means by which insurers can get funding or to make up losses caused by the law's inherent weaknesses. You talked about the risk corridor, which is one such mechanism. But what are some of the other ways that they supposedly can make up funding? And obviously, a bailout is the second thing in mind, right?
Yeah, well, there's the reinsurance fund, and that's actually even bigger than the risk corridors. That one was the appropriations were actually made in the Obamacare legislation, and this is just to help insurers cover some of their losses. It's what a reinsurance fund is, and there's $10 billion appropriated for that this year. Whether the whole $10 billion will be used, I don't know. But governments, of course, generally don't like to have money left over, so it could be used. And then there's the risk adjustment, which is specific payments for enrollees that an insurer may have whose expenses exceed a certain amount. And the report suggested that I think it was around insurers expect in total to take about $360 million from that part of the three R's, as they're calling them: the risk adjustment, the reinsurance, and the risk corridors. So you add in the possible $750 million to possibly $1 billion that will cost the taxpayers for the risk corridor, and you're talking in the neighborhood of an $11 to $12 billion in what I think is arguably bailout money going to the big insurers this year.
David, when the insurers and the president got together, and a lot of us remember when that all happened, and they sat down, you have to think that the insurers saw this as a win-win situation for them, because they were pretty much guaranteed kind of an amount of money at the outcome, right?
Oh, absolutely. It's a win-win for them. No two ways about it. I mean, you start with the individual mandate, which is supposed to require people to buy insurance. So supposedly there's going to be all these new customers lining up for their products. And if that doesn't happen to the degree they expect, or if it happens that you get a much sicker insurance pool, then there's the bailout money for that. So it was definitely a win-win for them, and it was a win-win for the administration. I mean, they, on the one hand, President Obama was constantly bashing the insurers in public and getting all the benefits of using that kind of rhetoric, but behind the scenes, he was getting the cooperation of the insurers, which I'm sure, of course, has many political benefits. So it was just, it worked out well for everyone except the American taxpayer.
Consumer, yeah.
And of course, many insurance consumers. It hasn't worked out too well for them either. But, hey, they're not big players in Washington, so, what do they matter?
And they don't really count in the game in terms of playing it because they don't necessarily know the rules. I want to talk about Valerie Jarrett in a moment, but something I've never asked you, David, and I think this is an important point. We have yet to see how many people have decided not to pay and what the bureaucracy can do about it. In a time when we've seen the IRS pretty well screwed up, we're seeing a lot of the companies out there. We've seen what the bureaucracy looks like here with the rollout of Obamacare. Are they going to be able to track down all the people who may eventually decide to, I'm not just going to have health care, I'm going to go to the emergency room when I have to, and they're still going to have to take care of me?
Boy.
Is that a big concern? I mean, no one talks about it, yet I'm sitting here thinking about it and saying, wait a second, if it goes from a small number to an uprising, what are you going to do?
Well, for starters, I mean, there are just so many factors that play into that make it hard to predict what.
Right, I understand that.
I mean, the CBO recently suggested that maybe only 4 million people would even be required to pay the fine. How many people are going to pay it if there's the only thing they're going to do really is withhold part of your tax refund. So tax refund, that isn't going to happen. And I mean, the first notice of this is going to come sometime, in early next year, and people are going to be upset about it. So there may be enough pushback that they have to, suspend the individual mandate. So at this point, I'm leaning toward, maybe some modest enforcement, but I think a lot of people are going to get away with not paying it.
I think you're right. I think there are a lot of people out there who are going to say, I'm not paying it, I'm not doing it, and if I get sick, I'm going to the hospital, which is kind of where we take back to square one, isn't it? Because we didn't want people doing that.
The other thing is, if you can get sick, you just have to wait until the open enrollment period under Obamacare, and you can sign up for insurance, and the insurers have to take you.
Exactly. The committee report that came out that we're talking about here exposes, and it says in here, just how closely President Obama's senior advisor, Valerie Jarrett, worked with health insurance leaders. Is there something wrong with her as a senior advisor working with them, or was there something done that was nefarious here that you're seeing?
In the legal sense, not necessarily, but in the broader sense of, do we want crony capitalism, which, I assume most people don't.
Yeah.
We want businesses to make their money by pleasing customers, not by getting special gifts from and favors from the government. In that sense, I mean, what she did was, part and parcel of the crony capitalism. I mean, from coordinating, helping out insurance company CEOs with their media appearances. And particularly, I think Pat Garrity, who was CEO of Blue Cross Blue Shield at the time, and who appeared on, I think it was Meet the Press. And then, going back and forth in terms of when the insurers are saying, look, if we don't get enough money out of the risk corridor program, you're going to be looking at premium increases of 20% or more. And then, she initially said that she couldn't really override her health policy advisors, but somewhere along the line, someone overruled them, and I can't imagine that Valerie Jarrett didn't have some role in that. So she's been part and parcel of this of the crony capitalism that's been going on with regard to Obamacare.
Well, she was meeting with lobbyists from Humana and Aetna and WellPoint Care First, Health Net Incorporated, and Kaiser Permanente, and a lot of others.
Oh, everyone had a meeting with her at one point.
But what was interesting about it, it looks like, and it says in the report, essentially, insurance companies presented the administration with a choice. Face significantly higher premium increases in 2015 for exchange plans, or make taxpayers bail out insurance companies. Or how about both? It might not be a choice. Maybe both. We'll go back and get into that with Dr. David Hogberg. Dr. Hogberg is a healthcare policy analyst for the National Center for Public Policy Research. He'll be right back with us here on the Gary Sutton Show on News Radio 910 WSBA. Welcome back to the Gary Sutton Show. Our guest this morning is Dr. David Hogberg in this segment. He's a healthcare policy analyst for the National Center for Public Policy Research. We're talking about a new report that's kind of a bombshell report, came out and exposed the behind-the-scenes creation of the massive Obamacare bailout. And the bailout of the insurance industry, according to this, now expected to cost taxpayers $1 billion in 2014 alone. And one of the things that you all did at the National Center for Free Enterprise is you basically went to these people in Aetna, Humana, WellPoint, United Health, and they all said that they're going to take the bailout money. And I know your organization, the National Center for Public Policy Research, is saying to them, don't do that, right, David?
Oh yeah, we basically asked them if they would forego this money from the taxpayers, because so much taxpayer money is already going into this thing, and most of them said we are not going to turn it down, and So, which, I think Aetna recently said that they expected 10% of their revenues from the exchange to come from the risk corridor. So, of course they're not going to turn it down. I think our tactic next year, since this it looks kind of like, the horse is pretty much leaving
late in the game, huh?
Well, what we're going to do is ask if they will not lobby to extend the program, because I have a funny feeling that, when this program expires in 3 years, the insurers are going to be worried they're going to be losing a lot of money.
Right.
And, so they'll lobby to try to have it extended, and we're going to try and get them on the record as to saying, no, we won't lobby. I doubt they'll go for that as well, but if they don't, either way, it generates press against what they're doing and generates press against Obamacare in general.
There's a part of this report that says, documents show that Ms. Jarrett, the senior advisor to the president, took the warnings of the insurance companies very seriously and indicated that the administration had given insurers 80% of what they sought. Insurers were not satisfied with the administration's first change and lobbied for additional protection. And in May of this year, 2014, the administration delivered to insurers modifying the risk corridor payment formula to increase the size of the bailout insurers could expect to receive. Mm-hmm. And I know Justin Danoff, one of your colleagues, said Congress has not appropriated the funds necessary to fuel this potentially unconstitutional bailout. So she says that Jarrett is on untenable legal ground when she claims authority to funnel American tax dollars to her friends in the insurance industry.
Well, so much of Obamacare is on very tenuous legal ground, isn't it?
Yeah.
But, it's not surprising given the way, they've treated so many other things from, which they're really under the law they probably don't have the power to do, like allowing people back onto their insurance plans, which, I'm perfectly fine with letting them do that, but it's not under the law. It's not allowed by the law, or suspending for a year the employer mandate. This is just, an extension of that sort of thinking, that we can kind of do what we want with this law. And, looking at the administration's language, even if Congress doesn't appropriate the amount of money needed for the risk corridors, the administration is just going to find it elsewhere. What I assume they will do is shuffle around some of the other funds that in Health and Human Services that Congress does appropriate money to, and try to come up with the money that way, even though legally they're probably not allowed to do it. But, given, you then have to depend on whether or not the courts want to get involved, and that can take a long time. That can grind on very slowly, so...
Two final points here, David, and one comes to what you said, and you were quoted on saying, you warned basically that once the health insurance industry gets used to these taxpayer bailouts, they may continue in perpetuity. I think that is one of the biggest worries that we have. If that's the Faustian bargain that has been struck between these two, between the administration and between the insurance companies, it almost becomes like an unfunded liability for the American people and an unfunded pension kind of situation, doesn't it?
Well, it's like Thomas Sowell said about bailouts. They're like potato chips. You can't have just one.
I laugh, but it's sad.
Look, anyone can get dependent on government money, including insurers, and I think that's, like I said earlier, that's why we're going to push next year, push them on the lobbying question, and after that, start making public noise, if you will, that they're going to lobby for this extension, and the American people need to wake up and stop it.
And I think the one thing that Danoff said in this, he says only when the public outcry and reputational risk to these specific companies starts to outweigh the taxpayer bounty will they likely retreat from these bailouts. But again, when you don't know about it, unless you hear places like this and other places that are talking about it, you don't know how to get into that game. Once again, as you mentioned in the very beginning, and hopefully you guys and others will get out there and continue to put the numbers out there that are real for people to be able to digest. David, always great having you on the show. Thanks so much for taking the time this morning. I appreciate it.
Well, thanks for having me on.
Have a great weekend. Take care.